Hello, I'm Dr. Yu. Today I'm here to discuss about Wilson disease. It's a very important area in organic psychiatry. This is important because many patients with Wilson disease can present with psychiatric manifestation. So this is a good idea to get familiarize yourself with the Wilson disease. 20% cases of Wilson disease present with exclusive psychiatric presentation in the form of mood disorder, including depression, mania, or psychotic disorder, suicidal behavior. The other features of the Wilson disease in case of hepatic involvement include the features of liver disease in the form of jaundice, ascites, abnormal or tremors like hysterexis, and other finding of the liver disease. The neurological manifestation of the Wilson disease can be in the form of memory difficulties, seizures, abnormal movement, or other features of Parkinson. If we see the etiology of Wilson disease, this is an autosomal recessive disorder. The problem lies in the metabolism of copper. The genes, which is called copper transporter ATPase gene, is muted. So this lead to increased absorption of copper from the gut and decreased excretion from the liver. And there is another defect, the protein which normally bind with the copper, that is the ceruloplasmin, is not able to incorporate the copper in this patient. Therefore, the copper build up in the blood and accumulate in many organs like liver, like brain, especially the basal ganglia and the eyes, kidneys. What the copper does, it do the something we called free radical damage or oxidative stress, which impair the functioning of these organs. If we suspect a case of Wilson disease with psychiatric presentation, neurological presentation, or hepatic presentation, then we have to take a detailed history. There might be a family history of Wilson disease, as we know this is autosomal recessive condition. A thorough examination in case of Wilson disease, general physical examination, especially checking for the signs of liver disease, the jaundice, Kayser Fleiser Ring, the neurological examination and abdominal examination are important part of the Wilson assessment. The investigation which are specific for Wilson disease, first of all, we will go for non-invasive investigation, which could be in the form of slit lamp examination, in which we can see Kayser Fleiser ring, that is deposition of the copper in the corneoscleral junction. The cave ring is seen in 95% of patients with neurological Wilson disease, while those who do not have neurological involvement, 50 to 60% can present or positive for slit lamp examination or Kayser Fleiser ring. This is also seen in those asymptomatic cases like the asymptomatic siblings who are suffering from the Wilson disease. The other investigation include 24-hour urinary copper. This investigation is important, which indicate the increased serum copper level, and which is indicated in the when we do 24-hour urinary copper. If the 24-hour urinary copper is greater than 100 microgram per 24 hour, this indicates a suspicious of Wilson disease, while some authorities the level greater than 160 microgram per 24 hour is indicative for Wilson disease. The other investigation, serum ceruloplasmin, which is usually less than 20 milligram per deciliter. We do the LFT as is present with the problem in the and the liver. The imaging studies are also important in the Wilson disease in the form of CT scan, MRI, and ultrasound abdomen. There is some hyperintensity and midbrain and hypointensity and the cerebral aqueduct, which is called the giant fonda sign. These are some of the investigation. The confirmatory investigation is liver biopsy. If we talk about the treatment of Wilson disease, it's important to manage the cases with biopsychosocial model, and we have to treat the patient biologically, psychologically, and socially. But the mainstay of treatment is, as we know, these patients have high level of copper in their blood, so we have to either give the copper chelator in the form of penicillamine or trientine. Another drug which actually increase the excretion of copper, that is what we call a cofactor for the copper metabolism, is called zinc sulfate, is also useful in Wilson disease. The other treatment, we have to treat the complication of this disease. If there is a liver involvement or is there any complication related to liver failure, we have to treat that. If there's any psychiatric or neurological condition, we have to treat accordingly. I hope this was useful. If there's any question, kindly write in the chat box. Thank you.